Hey everybody, my name is Dr. Scott Giacomucci, and I'm the author of a new book called Trauma-Informed Principles in Group Therapy, Psychodrama, and Organizations, Action Methods for Leadership. And in this video, I want to share with you some of the content from Chapter 3 of this book, which is titled Trauma-Focused Psychodrama as an Effective Group Treatment for PTSD. So in this chapter, I cover using psychodrama as a treatment for PTSD, for trauma, while also positioning psychodrama within the larger group psychotherapy research around group therapy's effectiveness for trauma and PTSD. So let's jump right into it. So group therapy is an effective treatment for PTSD and trauma. And the research on this continues to emerge and support its use as a treatment for trauma. Group therapy helps trauma survivors normalize their feelings and experience while realizing that they're not alone in their trauma. So often in the aftermath of trauma, we can feel like we're broken or we're alone or nobody could possibly understand or get what we're going through or how the trauma is experienced. So often in the aftermath of trauma, we feel alone. We feel disconnected from others. We feel like nobody could possibly understand what we've been through or how the trauma continues to impact us. This is where group therapy is particularly more helpful, perhaps, than individual therapy, in that there's a group of other trauma survivors that have been through similar things that do understand how the trauma has impacted someone. The peer support and mutual aid available within group therapy, that's just impossible in individual therapy, offers a way of reducing that sense of isolation, the shame related to the trauma, the stigma, the sense of hopelessness and helplessness, the self-judgment, and some of the other symptoms that come along with PTSD and CPTSD. In group therapy, the group becomes a holding environment or a healing matrix of sorts, providing a safe container for the traumatic memories to be explored, to be desensitized, for individuals to renegotiate their relationship to their trauma, and to reprocess the trauma. The group holding environment, it becomes an avenue to safely explore the trauma and tap into post-traumatic growth, to heal from it and to recover from it. The safety of the group and all the relationships within the group help a trauma survivor to trust again. They help participants to change their sense or perceptions of themselves. Remember, distorted beliefs about ourselves is one of the common symptoms after trauma. And the safety of the group, challenges all these distorted beliefs about ourselves, about others, and about the world. Group therapy focused on trauma provides opportunities during the group process to help others create a sense of empowerment, meaning-making, and post-traumatic growth, in that trauma survivors can turn their traumatic experiences into a source of inspiration and positive change for others in a very practical way, to find a way of using their experience to help others. If one is traumatized by a group or in a group setting, it makes sense that the healing would come in group setting as well. Group work oftentimes can just be more financially viable and more efficient than individual work, in that multiple clients can receive therapy at the same time, whereas in one-to-one therapy, it's one client at a time. This makes group therapy particularly appealing for treatment centers, for funders, and especially for insurance companies. However, the research on group therapy continues to demonstrate that it's at least as effective as individual therapy for treating multiple mental health conditions, including PTSD. So group work and group therapy operationalize the 6 trauma-informed principles outlined by SAMHSA in ways that individual therapy simply doesn't have the same opportunity to do so. Particularly when we're talking about principles, the trauma-informed principles of safety, transparency and trustworthiness, peer support, collaboration and mutuality, empowerment, voice and choice, and addressing issues related to identity, culture, history, and gender. Group work, because there's more people in the service, there's just going to be more opportunities and a multitude of relationships within the group that allow for us to embody these trauma-informed principles and for the group to engage with and experience these different trauma-informed principles that won't be possible in the same way, at least, in one-to-one therapy. So if you wanted to dive more into how group work and group therapy embody trauma-informed principles, I encourage you to check out another video I made on chapter 2 of the book, which covers this specifically. So next, I want to talk about psychodrama as an effective treatment for trauma and PTSD. So remember, psychodrama was developed as a group psychotherapy. Psychodrama is part of a triadic system: sociometry, psychodrama, and group psychotherapy. If you wanted to learn more about the basics of psychodrama, I encourage you to consider checking out the other videos on this channel. The previous video I just mentioned on chapter 2 of this book covers many of the basic theories, philosophies, and methodologies within psychodrama. I'm not going to go through all of that again in this video, although I will be talking about many of the classical psychodrama interventions in a little bit here. So the research on psychodrama as an effective treatment for PTSD continues to grow, showing that it's a promising treatment, a promising modality for treating PTSD and trauma-related issues. There's a bunch of different research studies about psychodrama's effectiveness for treating PTSD and trauma with different populations, including military veterans, folks in inpatient substance use disorder treatment, mass shooting survivors, children who survived natural disasters, victims of intimate partner violence, and other forms of trauma. Psychodrama is also included in the meta-analyses of other fields and categories, such as the creative arts therapies, the experiential psychotherapy meta-analyses, the body and movement-oriented intervention meta-analyses. And all three of the meta-analyses in these categories show impressive rates of effectiveness comparable to other PTSD treatments that are focused on CBT or prolonged exposure or talk therapy. So the creative arts therapies, experiential therapies, body movement-oriented therapies seem to be at least as effective as CBT and other trauma treatments that are considered the gold standard of PTSD treatment. There's just less research in these areas because they're harder to research. The majority of research on PTSD treatments has been done with cognitive behavioral approaches because they're easily manualized and replicated. Whereas the experiential therapies, psychodrama, drama therapy, art therapy, music therapy, somatic psychotherapies, other experiential approaches are hard or impossible to manualize, which makes them more difficult to replicate, which is one of the barriers to doing larger scale research studies on their effectiveness. Some of the other trauma therapies tend to have higher dropout rates, especially the therapies that involve participants exposing themselves to triggers related to the trauma, like prolonged exposure or telling stories related to the trauma. Some of these therapies can have higher dropout rates and can feel intolerable to participants who might not be ready to retell the story, remember, or relive the story of their trauma. In my 2020 research study on trauma-focused psychodrama, one of the interesting qualitative findings that emerged was that participants in the study who participated in trauma-focused psychodrama, they found that trauma therapy could be fun through psychodrama. They found that it was tolerable and that they even enjoyed themselves and laughed quite often during the treatment. Here's some of the quotes from some of the participants in my study. Participant said, "I always thought trauma groups had to be painful. I found that not to be truthful." Another person said, I was able to release and let go of my trauma without reliving it. Another participant said, I liked that it was also a fun experience. And someone else said, psychodrama was cool. So these quotes really highlight how psychodrama, even when focused on trauma, can be lots of fun and can be a tolerable alternative treatment to some other approaches that are commonly used to treat PTSD. Now, as the clinical research on the effectiveness of psychodrama for treating trauma continues to grow, the neuroscience research also continues to grow, and the neuroscience really supports psychodrama's effectiveness as perhaps a treatment of choice for treating trauma and PTSD. Moreno's the founder of psychodrama, he suggested nearly 100 years ago that the body remembers what the mind forgets. And this is echoed by trauma experts of today that really emphasize how trauma gets stored in the nervous system and in the body. Trauma impacts the body and the nervous system and parts of the brain below thinking, cognition, or even explicit memory. In some of the research on trauma and PTSD in neuroscience, they find that when we ask a trauma survivor to remember a traumatic memory and take a scan of the brain, that parts of the brain associated with language and speech appear to be completely offline. In particular, the Broca's area, which has to do with language and speech, seems to be offline when somebody's remembering a traumatic memory. And so this really challenges us as trauma therapists to reconsider some alternatives to talk therapy. If the part of the brain associated with language and speech is offline when trauma is activated, it means we have to use alternatives, movement, body, symbolic representation to help our clients tap into and express how they've been impacted by the trauma. Psychodrama's emphasis on symbolic representation, body movement, action, relationships, and other right brain processes positions it as an ideal trauma treatment in that it can access and renegotiate trauma in the places that it's stored in the mind, the body, and the brain. One of the most important neuroscience findings of the century is that the brain changes based on experience throughout the entire lifespan, not just until somebody's brain finishes developing when they're 23 or 25, but throughout their entire life. And so just like past experiences have an impact on our brain and its development, new corrective or positive experiences can also have an impact on the brain. So through the surplus reality of psychodrama, we can offer participants with experiences that might be impossible in real life, that might offer closure and a renegotiation on a neurobiological level of how the trauma from their past has impacted them and continues to impact them today. So I want to challenge you to reflect on a couple questions at this point. How can you incorporate body-oriented interventions into your work with trauma? And in what ways can you actively work to provide corrective emotional experiences for the clients that you serve? Whether that's through psychodrama or role-playing, or more implicitly through relationships and through the structures in your agency and groups. The next section in this chapter talks about post-traumatic growth through psychodrama. So post-traumatic growth is the phenomenon of growing in the aftermath of trauma. Post-traumatic growth is not a new idea. It's been around for centuries, really. And you can find examples of post-traumatic growth in any legend or myth or religious history. But it's only been the last couple decades that psychologists and mental health professionals have been studying post-traumatic growth. Some of the research on post-traumatic growth is quite interesting and very optimistic and hopeful. In the research, they find that 1 out of 4 adults that experience trauma are going to develop post-traumatic stress disorder, whereas 2 out of 3 adults that experience trauma report growing from the trauma in some way. So that means you're significantly more likely to grow in the aftermath of trauma than you are to develop PTSD, which is very hopeful. It's important to note at the same time that in the aftermath of trauma, it's not abnormal to experience both some aspects of PTSD and some aspects of post-traumatic growth. That would be pretty normal. Although they seem to be inversely related, they also can exist at the same time. After thousands and thousands and thousands of surveys and interviews with trauma survivors from around the world, the post-traumatic growth researchers identified 5 common areas of post-traumatic growth that trauma survivors tend to report growing in the aftermath of trauma. So I'm going to go through these 5 areas briefly, and they're not in any specific order. So the first is about new possibilities in life. So in the aftermath of trauma, although trauma might flip our world upside down and close some doors and opportunities, it also opens other doors. And trauma survivors often report experiencing or finding new possibilities in life in the aftermath of trauma. Simple example is that someone who experienced trauma might come to realize that they can use their experience to help somebody else, and that was not a possibility for them prior to that experience. Second area is about an increased awareness of personal strength, that trauma really challenges us to muster up all of our strengths, our courage, our resilience, our stability and groundedness and empathy and understanding and grace. And in the aftermath of trauma, we might come to realize that we're much stronger than we thought we were. That if I could survive that horrible thing I went through, man, I could probably survive anything that life throws at me going forward. The third area of post-traumatic growth is about increased relationships with others. So in the aftermath of trauma, naturally, we're going to look to the people closest to us, the safe and helpful people in our life, to support us, to help us ground ourselves and regulate ourselves and make sense of our experience. And we might come to develop a stronger relationship with them. We might experience trauma in the context of a relationship. And in doing so, we might restructure our priorities about who are the people most important to us, who are the people we want to invest our time in. And we might develop an enhanced relationship or a sense of relationships or importance of relationships as a direct result of the trauma. The fourth area of post-traumatic growth is a stronger appreciation of life. So trauma often by its nature is something that threatens our life or the life of someone we care about. Oftentimes through trauma, we come face to face with death. And in doing so, we often can develop a greater appreciation or gratitude for life, or come to realize just how short, how fragile life can be. That the deeper our experience of sorrow and tragedy is, oftentimes the deeper our experience of joy and gratitude can be too. And the fifth area of post-traumatic growth is an enhanced sense of spirituality or religious change. That because trauma so often happens because of other human beings, we might look beyond human beings for inspiration, support, or guidance in the aftermath of trauma. We might turn to our religious beliefs. We might turn to God or spirituality or other existential practices to try to make sense of the trauma, to heal from it, and to grow from it. So these are the 5 areas of post-traumatic growth. A new sense of possibility in life, increased personal strengths, enhanced relationships, stronger appreciation for life, and a deepened spiritual or religious experience. And I want to emphasize that these are also the same 5 areas of vicarious post-traumatic growth. So vicarious post-traumatic growth is the opposite of vicarious trauma. So vicarious trauma describes the experience of being traumatized by hearing or learning about somebody else's trauma. Oftentimes, mental health professionals or medical professionals or first responders experience vicarious trauma through their work. And I want to highlight that the same professionals that work with trauma survivors and are at risk of vicarious trauma also might experience the benefits of vicarious post-traumatic growth. That as professionals, we can also grow personally and professionally through our work with trauma survivors and through seeing trauma survivors grow as a result of their trauma. It's not uncommon for professionals, including myself, to feel inspired or impressed or just really amazed by the courage, the growth, the character of the clients that we work with, and the ways that they face their trauma and heal from their trauma, grow from it. And it can help us as professionals, because we're human too, it can help us grow in our own life, not just professionally, but also in our personal life. And we'll talk more about vicarious trauma and vicarious post-traumatic growth in chapter 11 of my book. So, psychodrama is unique in its capacity to cultivate post-traumatic growth in action. Rather than just talking about post-traumatic growth, we can explore and interface with the different areas of post-traumatic growth through sociometry, through role-playing, through sociodrama, through empty chair work, in action. In the research on psychodrama, in a study I published in 2022, we found that there was a positive relationship, a correlation, between spontaneity and post-traumatic growth in participants of a 3-day psychodrama workshop. That as their spontaneity increased, so too did their post-traumatic growth levels. So remember from the video on chapter 2, spontaneity is considered the curative agent in psychodrama. It's really the most important aspect of psychodrama enactments and psychodrama theory and philosophy. And we define spontaneity as this life force energy that occupies us and allows us to have adequate responses to new situations and new responses to old reoccurring situations. And so through spontaneity theory, we would conceptualize trauma, or PTSD rather, as a deficiency of spontaneity, that we're stuck in the trauma, or pathological spontaneity, in that there's a sense of chaos that's characterized by PTSD symptoms. And that somewhere in between this deficiency of spontaneity and this pathological spontaneity, somewhere between this rigidity and this chaos, is mental health and healthy spontaneity. So in psychodrama, trauma-focused psychodrama, we would try to help our clients warm up to and tap into their spontaneity so they could develop new responses to their PTSD symptoms and the way the trauma has been internalized within, so that they could cultivate a sense of trauma recovery and post-traumatic growth for themselves. Some of the other research on post-traumatic growth even shows that creativity and creative self-efficacy seems to be a key mediator for participants who grow in the aftermath of trauma. And remember from the previous video that spontaneity and creativity are twin concepts. They go hand in hand. Whenever spontaneity emerges, creativity finds its way to the spontaneity. So these research findings tend to highlight the connection between spontaneity and creativity theory and post-traumatic growth, suggesting that psychodrama could be a really effective treatment for PTSD and an avenue for helping participants cultivate post-traumatic growth in their trauma recovery. In my work with trauma, one of the things I like to do is provide some psychoeducation about post-traumatic growth and those 5 areas I outlined, and suggest to my clients that these 5 areas of post-traumatic growth can be a template for them in conceptualizing and envisioning what trauma recovery could look like for them. That in cultivating a vision of themselves in the future in recovery from trauma, they can use these 5 areas of post-traumatic growth as a sort of scaffolding for imagining what it would look like to heal and to grow from trauma, to no longer be impacted by trauma in the same way, but to turn that PTSD into post-traumatic growth. So I want to pause here for a moment, and I want to encourage you to reflect on which of these 5 domains of post-traumatic growth do you notice the most in the clients that you work with? Which of these areas of post-traumatic growth do you feel like you do the best job cultivating in your work with clients? And which of these areas of post-traumatic growth do you think you could focus more on, perhaps you've been overlooking in your work with trauma? Furthermore, I want to challenge you, if you're a professional, to consider how your work with trauma survivors has challenged you to grow or inspired you to grow, both as a professional and as a human being working with trauma. Has your work in the field helped you see new possibilities in your own life? Has it helped you find and tap into your own personal strengths as an individual? Has it helped you cultivate deeper relationships in your personal life? Has it given you a stronger appreciation for life? And has it helped you recommit or develop a stronger commitment to spiritual or religious practices? So how has your work with trauma survivors inspired you to grow? So the next section of this chapter outlines how classical psychodrama techniques are inherently trauma interventions. So there's dozens and dozens of different psychodrama interventions and techniques, and I'm only going to be covering some of the main primary psychodrama interventions in this video. And I'm going to be covering them briefly. And so before trying to implement these interventions, it would be important that you see them in action and attend psychodrama trainings, rather than just watching this video and trying to incorporate some of these interventions. Without proper training and supervision, you have the potential of harming somebody with some of these interventions. So the 3 primary classical psychodrama interventions are the double or doubling, the mirror position, and role reversal. And these 3 interventions also reflect the 3 phases of Moreno's developmental theory, which we covered in the previous video on chapter 2 of the book. And here's a quote from Moreno in 1952, highlighting the connection between the interventions and the developmental theory. And so we might say that the double, the mirror, and the role reversal are like 3 stages in the development of the infant, which have their counterpart in the therapeutic techniques, which we can use in the treatment of all human relations problems. And if you wanted to dive more into this concept of how the psychodrama interventions of doubling, mirror, and role reversal can be used and guided by the developmental phases in psychodrama, I would encourage you to check out my previous book, Social Work, Sociometry, and Psychodrama. The chapter in that book on psychodrama interventions really goes into depth about using the developmental theory as a clinical map for guiding the interventions we choose to use in psychodrama. I'm not going to go into all of that in this video, but I would encourage you to learn more in my previous book. My 2021 book is actually available for free through the publisher, Springer Nature. You can download the entire book for free, either through the publisher or even on Amazon's Kindle book offerings. So the first intervention I want to talk about is doubling. So there's lots of different types of doubling, and I'm not going to go through all of them here. There's the role of the double, there's doubling statements, there's doubling that could come from audience members in the group, the therapist or the facilitator could offering doubling statements. There's the containing double, the cognitive double, the deepening double, the triple double, the body double, the somatic double. There's all sorts of different types of psychodramatic doubles that have been created over the years. I'm going to try to just keep it simple today and talk about classical psychodrama doubling. So the Morenos, when they used doubling, they primarily enrolled an individual in the role of the double. And this individual would stay in that role, stay with the protagonist, and offer doubling statements throughout the entire psychodrama. Oftentimes, this was either another participant in the group or a trained staff member that understood how to effectively use doubling. Nowadays, doubling also gets integrated into psychodrama through the director using doubling statements, or by inviting audience members to come out from the audience and to offer a single doubling statement and then to go sit down. The way that psychodrama doubling looks in an actual psychodrama is that the protagonist will be having a discussion with another role in the psychodrama scene, and somebody might come and stand next to the protagonist and offer a statement from the perspective of the protagonist to the other role, a statement that they think hasn't been articulated yet, that might label or deepen the internal experience of the protagonist. Just one sentence. And the protagonist is invited to consider if that fits for them or not. If it fits for them, they're encouraged to repeat it in their own words to the other role. And if it does not fit for them, they're encouraged to change it and change it to something that does fit for them. So doubling is a really helpful intervention, especially for trauma survivors, in that it helps the protagonist or the client to sort out, differentiate their internal experiences, and to accurately label and express what's going on for them internally. Helps them find words for what they might not previously have words to express related to the trauma or the sensations in the aftermath of trauma. It can help them express unexpressed feelings. It can help integrate new cognitions and new perspectives. It can promote a sense of integrative catharsis, and it can help a trauma survivor develop a more coherent internal narrative about their experience of the trauma and their experience in trauma recovery. Doubling is a way for other group members and the therapist to show the protagonist that you're with them, that you empathize, that you're attuned to their experience, that you understand, that you're fully witnessing what's going on. It provides a sense of social connection and safety for the protagonist. And because of all these reasons and ways that it's important, doubling really is a trauma-informed and trauma-focused intervention within the psychodrama modality. The second intervention I want to talk about is the mirror. So the mirror is an intervention that I feel like gets underutilized in psychodrama practice, but can be really useful. Basically, what the mirror position would look like in a psychodrama is that we'd be in the middle of a psychodrama scene, and a protagonist might be talking to parts of themselves or might be talking to somebody else in their life. And we would employ the mirror intervention by asking the protagonist to step out of the scene and to see the scene replayed in front of them from a distance, to see themselves in action, to see their behavior, to see the scene mirrored back to them, essentially, but in action. Someone else would step into the role of them, and they would be able to see themselves in action. So the mirror position gives the protagonist some distance from the psychodrama, and it can be really useful if the protagonist is struggling with a sense of denial or minimization about their feelings or about the experience or about how their behavior or words might impact others. The mirror position allows you to facilitate a reenactment of the situation with the protagonist seeing themselves in action. It also can be really useful for a survivor of trauma when you're doing a trauma-focused psychodrama, in that you can pull the protagonist out of the scene so that they can observe the psychodrama rather than being in the middle of it. And this might feel safer and more comfortable for a trauma survivor before returning to the role of themselves and being in the middle of the scene. It can provide them with a new sense of perspective and safety at seeing themselves and seeing the scene from some distance rather than seeing it just subjectively from their own experience. So the mirror position can be really useful for titrating or pendulating in and out of overwhelming emotions that could come up while working with traumatic memories. The mirror position can also be really useful for integrative integrating really powerful and transformative moments of a psychodrama. So, for example, if the protagonist engages in a scene that was really corrective and just really healing, really memorable for them, and we wanted them to really savor that moment, to take that in and to integrate that on a deeper level. After they experience the scene in the role of themselves, and perhaps even from the role of others in the scene through role reversal, we could then have them step into the mirror position and watch the scene replayed in front of their eyes. So they could take in that scene from the third person as well, and really deepen their experience of the moment. So the mirror position can be really useful as another trauma-informed and trauma-focused classical psychodrama intervention. We tend to use the mirror position much more in psychodramatic sculpting than we use it in more purely psychodrama enactments. And we'll talk about psychodramatic sculpting in a couple minutes here. The next intervention from classical psychodrama that I want to highlight is the role reversal. So the role reversal is really the kind of the key, the linchpin of a psychodrama enactment. It's one of the things that makes psychodrama different from other modalities that employ the empty chair or that employ role-playing. In that in psychodrama, we don't just role-play or talk to an empty chair, but we also facilitate the protagonist reversing roles with whoever was in the empty chair or whoever else was in the role-play, to deepen their experience, to leave the role of themselves and see themselves through the eyes of somebody else, to access their spontaneity in other roles and expand their sense of self. So this is really the most important intervention in psychodrama, and it really helps the protagonist deepen their experience of the process, to tap into their spontaneity and creativity, to develop new perspectives, new integrative catharses and abreactive catharses, to develop new empathy for themselves, for others, for the situation, to deepen their awareness, and to provide closure that would be impossible without the role reversal. And so there's some important guidelines to consider for safely using role reversals, especially related to trauma-focused psychodrama. Role reversal is one of these interventions that you could hurt somebody with if you're not careful and don't have adequate training and supervision in psychodrama. Remember that role reversal is the third phase of child development. So we'd want to use doubling and mirroring and make sure that the protagonist is grounded and has established some safety before we use role reversal. Especially if you're unsure about the psychiatric stability or emotional stability of the protagonist, then I would really encourage you to first emphasize doubling and the mirror position before using any role reversal. Especially using role reversal with any antagonist roles or trauma-based roles. So you'd want to ensure that the protagonist and the rest of the group can first interact with a trauma-based role or an antagonist role in an adult ego state and from strength-based roles before you role reverse them and have them play the role of an antagonist or perpetrator or victim in the scene. Otherwise, you might re-traumatize the protagonist or the group. You might contribute to dissociation or defense mechanisms or regression in the protagonist, and they might get stuck in that role, and you might have difficulty getting them back out of that role, back to an adult ego state. This is why it's so important that you don't just role reverse someone immediately into a perpetrator role or a victim role or an inner child role or an antagonist role, that you first have them interact with that role from an adult ego state with support and with strength-based roles accompanying them. Instead of using a role player to play the role of a trauma-based role or perpetrator role, you might consider using an empty chair or an object instead. Or you might first use an empty chair or an object to concretize a trauma-based role before having somebody play that role. Using an empty chair or an object gives a lot less power to that role. And oftentimes, in the case of trauma, the perpetrator or the antagonist in the scene has already taken enough power from the protagonist, and we don't want to contribute to that further. We don't want to help the protagonist or the group further internalize the perpetrator or the antagonist. We want to give them a sense of control and safety and renegotiating the power that the perpetrator took from them. And one way of doing that is that you don't give the perpetrator more of a voice than they already had. You use an empty chair to represent them or an object. And then you want to make sure, if you have a role player play an antagonist role or a perpetrator role, that you really do adequate de-rolling after the psychodrama scene. So oftentimes the de-rolling just involves having a protagonist or a role player wipe off the role, like physically wipe it off, and then verbally approach the protagonist and verbally tell them, hey, I'm no longer your father from the psychodrama. I'm Scott, and I'm just a group member here. There's other ways of facilitating de-rolling. You could do it through concretization. Many times we'll use a scarf or fabric or a prop to represent when somebody's in the role, and then it becomes easier to take off that scarf or prop to symbolize de-rolling from the role. Another thing you could do is you could facilitate the role player that played a perpetrator role in the scene, put the role into an empty chair in front of the group, and to separate themselves from that role by telling the group how, as an individual, they're different from the role they played. You might say, hey, can you list 3 different ways that you're different from that angry, demanding father role that you played in the psychodrama today? So there's different ways of de-rolling, and you want to make sure you do adequate de-rolling, especially if somebody played the role of an antagonist or perpetrator in psychodrama. The next intervention I want to highlight is the soliloquy. So the soliloquy is an intervention that was taken from the classical theater, and Moreno developed it as a therapeutic technique. And it's just like it sounds. It's where we would have the protagonist or role player offer a monologue as if nobody else was listening. So we might say to the protagonist, in the middle of a scene, I want to pause the scene right here. This feels like a really important moment. I'm going to pause the scene, and I want to offer you the opportunity to provide a soliloquy about what's going on internally for you in this moment in the scene. Just speak aloud as if nobody was here and nobody was listening. What's going on internally? What's going on emotionally? What's going on in your body? What are you thinking and feeling about this moment right here, right now in the psychodrama? You can also use a soliloquy with a role reversal. So you could ask the protagonist to reverse roles with another role in the scene, and then to invite them to provide a soliloquy from the perspective of the role that they're role reversed with. And this can really deepen their experience of the role that they're playing. The soliloquy is a helpful trauma-informed and trauma-focused intervention in that it can slow down the psychodrama process and provide that sense of titration and safety, slowing down and helping to differentiate feelings and thoughts and sensations in the midst of working through trauma. It also gives the director really important information about what might be going on for the protagonist in the psychodrama, which can provide some clues on where we might need to go next. Next intervention I want to talk about is concretization. So concretization is where we take something that's invisible or non-physical and we use an object to represent it or to symbolize it. For example, we might ask the protagonist to choose an object in the room here to represent your courage. And they might look around and they might say, I'm going to choose this object here to represent my courage. And we might ask them to place the object nearby so that they can have a reminder of their courage throughout the psychodrama. Or we might ask them to reverse roles with the object and to speak to themselves from that voice of courage. So concretization can be really a powerful tool in that it allows us to externalize parts of ourselves or feelings or thoughts or beliefs or even trauma or mental health symptoms. We could ask the protagonist to choose an object to represent their fear, choose an object to represent shame, choose an object to represent your defense mechanism that keeps coming up, the wall that blocks you off from connecting with others. And concretization can give the protagonist a sense of control over some of these symptoms or feelings that might feel really overwhelming or overpowering internally. It helps them differentiate themselves from their feelings or symptoms or defenses, or even their trauma. Concretization is about symbolic representation, and it provides a bridge between the internal reality of the protagonist and the external reality of the group. Concretization is really useful for trauma-focused and trauma-informed psychodrama in that it allows a reorganization of internalized parts of ourself. We could even use concretization in one-to-one psychodrama and have the client choose different objects to represent different parts of themselves, and then to speak to those different parts, to rearrange those parts of themselves in a different proximity or relationship to each other or to themselves. It really helps the protagonist provide a sense of control, a sense of renegotiation, distance and closeness, and a reorganization of what they're experiencing internally. It also can provide a reminder and a deepening of relationship with their strengths or with supportive roles in psychodrama work. So I often will have clients or protagonists choose objects to concretize different strengths or supports that they might need in order to face and heal from trauma. Choose an object to represent a new perspective, and the protagonist might choose, I have camera lenses around, so might choose a camera lens to represent new perspective. And I might have the protagonist reverse roles with the camera lens, representing new perspective, and to speak to themselves from new perspectives, to deepen their post-traumatic growth, or to deepen their understanding or awareness, or to help them see the situation or see themselves from new perspectives. So concretization is a really fundamental psychodrama tool, and it's one of those interventions that you could probably start using earlier in your psychodrama training before you start using other things like role reversal. The next intervention I want to talk about is the empty chair. So the psychodramatic intervention of the empty chair is an intervention that's very similar to concretization in that we're taking an empty chair and we're using it to represent another role or a part of the protagonist's self, or another person in the protagonist's life. So the empty chair can be used in individual work or in group work, and we can use one empty chair or we can use multiple empty chairs. We can use empty chair work psychodramatically, but we can also use it sociodramatically. The empty chair intervention can be used as a warm-up. It can be used as in the action phase of the group. And it really is a very versatile tool, intervention, that you can use with just about any topic and in any group or setting. Empty chair work was really popularized by Fritz Perls and Gestalt therapy. And many people mistakenly believe that Fritz Perls created the empty chair. And he even claimed to have created it initially. But in his autobiography before he died, he ended up giving credit to Jacob Moreno and Psychodrama for first developing the empty chair. So the empty chair is another intervention that you can use to help a client work through trauma, or you can use through a trauma-informed framework. Moreno often described the empty chair as the four-legged auxiliary. That usually we call the other role players auxiliaries in psychodrama, and that in lieu of other role players or group members, we can use empty chairs as auxiliaries. The next psychodrama intervention I want to highlight is psychodramatic sculpting. So psychodramatic sculpting is where we would have the protagonist choose other group members and physically place them in the scene, or symbolically place them in the physical space to represent their relationships to parts of themselves, to members of their family, or to recreate a static moment from their past. For example, we could ask a protagonist to sculpt their family of origin. Choose people here to play the roles of each person in your family of origin. Choose someone to play the role of yourself as well. Come place yourself in the middle of the stage here. And now symbolically place the other auxiliaries in relationship to yourself on the stage based on how far or close you felt to them. And give them all a body posture to symbolize your relationship to them or their relationship to you. And this can be really powerful exercise to use. We can also use it for parts of self. Once you did name 4 different parts of yourself that feel really meaningful, and choose other people to play those roles, and position those different parts of yourself in relationship to you. We could also take a moment from the past, perhaps a moment that was really transformative and meaningful, or a moment that was really confusing, or a moment that was really painful or traumatic. And we can use psychodramatic sculpting to revisit that moment in a safe and slow and gradual way. So you could have the protagonist describe that moment from their experience in the past, choose other group members to play the different role play, the different characters in that scene, the different people that were involved, and to physically recreate that moment in time, that frozen moment. And then you could use different interventions like doubling, role reversal, concretization, soliloquy to deepen the experience of that moment, to express unexpressed feelings from that moment, to help the protagonist get unstuck from that moment and how it impacted them, and to develop a new perspective, new integration, to heal and move on and grow from that experience in the past. Now, psychodramatic sculpting is fundamentally different from psychodrama in that the protagonist is usually choosing someone to play the role of themselves in psychodramatic sculpting, and the protagonist is often outside of the scene in the mirror position for the majority of the process in psychodramatic sculpting. Whereas in psychodrama scenes, the protagonist is in the role of themselves throughout much of the scene and does not spend a lot of time in the mirror position. So this is one of the fundamental differences between psychodramatic sculpting and psychodrama. Sculpting is also much slower, much more gradual, and because of that, it's much safer. In a psychodrama scene, the roles might be moving around and be very spontaneous, and it's very dramatic and chaotic at times. Whereas in psychodramatic sculpting, the roles are much more static, there's less movement, there's more control and containment in the process, and oftentimes there's much less talking. It's more kind of physical and embodied than a psychodrama. So because of this, psychodramatic sculpting can be a really good warm-up to a psychodrama. It can be a good way of warming up a group that's new to psychodrama. And it can be a really good stepping stone for somebody who's new to facilitating psychodramas before they start facilitating fuller and more intense and dramatic psychodramatic scenes. Starting with psychodramatic sculpting is a good idea. So sculpting is something that can be used to help trauma survivors heal from trauma, and also can be used as a trauma-informed intervention. Next, I want to talk about psychodramatic letter writing and psychodramatic journaling. So these are also really useful interventions for somebody new to facilitating psychodramas. Psychodramatic letter writing and journaling are really simple and a really good starting place for starting to implement psychodrama interventions. Psychodramatic letter writing is essentially where we instruct a client or the group to write a letter from themselves to another part of themselves or another version of themselves in the past or future, or to somebody else in their life. So they're imagining that they're sending a letter to someone or to a part of themselves. Psychodramatic letter writing can be really powerful for helping clients express unexpressed emotions, tapping into a sense of closure, expressing things that they just couldn't express in real life, such as anger or shame or guilt or sadness or love or gratitude. Psychodramatic letter writing can be really useful for working through grief and loss. In psychodramatic letter writing, we can also take the process a bit further by having the client write a letter to themselves from another part of themselves, or from another version of themselves, or from somebody else in their life. And you can often start with writing a letter from yourself to someone else, and then as a second letter, facilitate the role reversal through writing, where they're writing a letter in response from that other person to themselves. So I find this to be really useful for grief and loss, for forgiveness, for deepening relationships, for tapping into support and strengths, spirituality, and archetypal roles. For example, if I have a client whose goal is to deepen their relationship with God or their higher power, I could ask them to write a letter to their higher power, asking questions and expressing feelings that they have towards their higher power or God. And then once they complete that exercise, I could ask them to now write a letter from God to themselves, a letter that they wish they could receive, expressing all the messages that they crave to hear from God. Another way of using it is with grief and loss. Many of the clients that I work with have experienced traumatic loss, and oftentimes these are really sudden and unexpected losses. And the client walks away from this loss feeling a sense of guilt or shame, or just feeling like it's really unresolved for them and that they have no way of resolving it. So when the client's ready to do the grief and loss work, I might ask them to write a letter to the person that died, expressing all of their sadness and their self-blame and all their feelings, the things I didn't get a chance to say to that person before they actually died. And once they complete that letter, we'll process it and share about it and explore what came up for them as they wrote it. And then I might ask them to now write a second letter from the person who died to themselves, expressing all the things that they wish they could hear from that person, all the things that they need to hear in order to stop blaming themselves for the death, in order to have a sense of closure in the loss, in order to make meaning of that person's death and to heal from it. So this can be a really powerful intervention. Similar to psychodramatic letter writing is psychodramatic journaling. Psychodramatic journaling is where we have a client write a journal entry from a different role or a different part of themselves or the role of a different person, or even from the perspective of themselves at a different point in time. So, for example, I could ask a client to connect with a vision of themselves in the future in recovery from trauma, perhaps a year from now, and to write a journal entry from the perspective of themselves in the future in recovery from trauma a year from now. Write a journal entry at the end of the day, sharing and reflecting on the sense of meaning in their life today, a sense of purpose, the closeness and intimacy in their relationships, their sense of respect and strengths that they've tapped into within themselves. We could also use psychodramatic journaling to help a client develop a deeper sense of awareness or perspective of somebody else in their life. I could use it if a client were struggling to see things from the point of view of their partner. I could say, I want you to write a journal entry from the point of view of your wife about the conflict in your marriage. Write an entire page about how you think your wife experiences you and what her feelings and thoughts are on this conflict that you're working through with her. And that could be really illuminating for the client. We could also use it in trauma-focused ways. We could have the client revisit a moment in the past where they experienced trauma and write a journal entry from themselves in the past, expressing what they were feeling in that moment or feeling at that point in their life. Oftentimes, in the midst of childhood trauma especially, the child doesn't have a chance to work through those feelings, to express their feelings, to sort out and differentiate all the many feelings that they're having, or to have a healthy adult listen to them and validate their feelings. So psychodramatic journaling is an opportunity to do just that. There's lots of different ways that you can use journaling, psychodramatic journaling. You could do it for different parts of self. For example, if I have a client who is really ambivalent about going to treatment for their substance use, I could invite them to write 2 different psychodramatic journal entries. One from the perspective of the part of them that really does not want to go to treatment, and to put all of that into a journal entry. And another journal entry from the perspective of the part of them that really does want to go to treatment and knows that they need to. And this can help them work through internal conflicts and to differentiate different parts of themselves, to express what's been unexpressed. So you can use psychodramatic letter writing and journaling in one-to-one settings. It's really useful as homework in between sessions. You can use it in a group setting where you have everybody write a letter or a journal entry. You could use it, you can even modify it in shorter, simpler ways by describing it as a psychodramatic postcard instead of a letter. That way you're going to challenge the clients to keep it to just maybe 2 or 3 sentences, what's most important to say, rather than writing paragraphs and paragraphs or pages and pages and pages, which some clients will do if you give them this assignment. So it can be a really useful warm-up or introduction to psychodrama. It can also be really useful as the kind of action phase of a group. And you could invite participants who are willing to share their letters aloud, and then to engage in a group discussion about how the letter writing was for them. What emotions came up throughout the process? What are you taking away from this process? How was it helpful? How was it difficult? So psychodramatic letter writing and psychodramatic journaling, again, are really useful tools for newer practitioners to psychodrama, in that there's much less risk of re-traumatization or causing harm in using psychodramatic letter writing or journaling as compared to trying to facilitate a full psychodrama. It just provides us more control and containment in having it on pen and paper than acting it out. And the last psychodramatic intervention that I want to highlight is role training. So role training is a way of rehearsing and practicing and strengthening one's connection to new roles in their life. So you could think of role training as providing the client, the group, or the protagonist as an opportunity to rehearse and practice for future situations that they might find themselves in their life, in their relationships, or even intrapsychic situations. If you're familiar with other types of therapy, sometimes this gets described as a future template or a future projection. So many times we use role training as the final scene in a larger psychodrama with multiple scenes, where after exploring a presenting issue and working through the core issue and past memories associated with the development of that problem, we might move the protagonist to a final scene focused on role training for the future. Next time you're faced with a situation that might trigger this trauma, or next time you're faced with a situation that might lead to more trauma, how are you going to respond to that? And let's practice responding to that through role-playing in action. Role training can be really useful in educational settings and in organizational settings to practice new competencies and new role behaviors, for example. So I'll often use role training structures in my training sessions, in my classrooms, and organizational meetings to help participants refine different skills that they might need on the job, interacting with clients, interacting with community members or with students. I find role training really useful in my own personal and professional development. I use it before negotiating a salary or a contract with a CEO of a treatment center that I might work for. I'll practice having that conversation with them and reverse roles with them and try to see the situation from their perspective, to see myself through their eyes and consider what they might need to hear in order to hire me or in order to give me a raise, for example. Role training can be really useful in helping ourselves or our clients or our students work through some of the anxiety that they might feel about future situations and to tap into some spontaneity and confidence before they encounter that situation in real life. I often use role training in my client groups to help clients practice setting boundaries, to help clients practice expressing gratitude or asking for help. It can be really useful for practicing difficult conversations, practicing tapping into aspects of post-traumatic growth. So there's lots of different helpful uses of role training. So like I had mentioned, these are just some of the more popular psychodrama interventions. This is not by any means a comprehensive list of psychodrama interventions. But in this video, we covered doubling, the mirror position, role reversal, soliloquy, concretization, the empty chair, psychodramatic sculpting, psychodramatic letter writing and journaling, and role training. In the previous video, I also talked about the social atom, which is another popular psychodrama intervention. All these interventions can be used to treat trauma, and all these interventions are inherently trauma-informed, trauma-focused interventions. So the next part of Chapter 3 outlines different trauma-focused psychodrama models and different ways of thinking about trauma-focused psychodrama. So remember from previous videos on this channel that trauma-informed and trauma-focused are two different things. Trauma-informed describes the larger framework and philosophy from which we provide services. Trauma-informed does not necessarily mean that we're treating PTSD. Trauma-informed instead is a larger framework or process through which we can provide any type of service. Whereas trauma-focused describes the actual content of the services being focused on trauma, treating PTSD, CPTSD, or trauma-related issues. So that being said, trauma-informed psychodrama would be different from trauma-focused psychodrama. Trauma-informed psychodrama or trauma-informed group therapy would be group therapy or psychodrama that's practiced while keeping in mind the 6 trauma-informed principles: safety, trustworthiness, transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and addressing issues related to identity, culture, gender, and history. So in trauma-informed psychodrama, the practitioner would keep in mind the different ways that trauma impacts an individual and how widespread trauma is, and would respond in the way that they're practicing to try to avoid and resist re-traumatization. So trauma-informed psychodrama. Trauma-focused psychodrama, on the other hand, would be focused specifically on trauma, on PTSD, on treating it, and providing avenues for healing from trauma. A trauma recovery group using psychodrama would be trauma-focused, or a post-traumatic growth group would be trauma-focused. Now, it's important that we're using them in conjunction as well. We can't do effective and safe trauma-focused psychodrama if we're not also operating from a trauma-informed framework. Just because we're treating trauma does not mean that we're trauma-informed. Actually, I've seen many examples of folks treating trauma or PTSD and doing it in ways that are not trauma-informed, that are causing harm, that are re-traumatizing clients. So we really need to be aware of these trauma-informed principles in psychodrama, group therapy, and really any trauma-focused setting as well. So psychodrama has been around for 90 years, 100 years. It's been around for quite a while. 90 years as a treatment approach, almost 100 years since its inception in non-clinical settings. It originated in 1921, according to Jacob Moreno. He says that April 1st, 1921 was the birthday of psychodrama. And it was created long before PTSD was recognized as a diagnosis in 1980. And because psychodrama can be a powerful tool, it's the kind of tool that you can use to create extraordinary healing for clients, but also can be used to harm and re-traumatize clients if it's not used appropriately. And in the 70s, 80s, 90s, psychodrama developed a reputation for being re-traumatizing for clients because it was used in ways that were not trauma-informed, and it was used by folks that didn't have training in trauma or didn't even have adequate training and supervision in psychodrama, but were using it anyway. Now, in response to that, and in conjunction with all the new neuroscience research coming out about trauma, there are different trauma-focused psychodrama models that were created and that emerged in the 90s and early 2000s. One of which is the therapeutic spiral model. So the therapeutic spiral model is a clinically modified psychodrama model for working with trauma, and it was created with a focus on intrapsychic roles. So one of the things that's unique about the therapeutic spiral model, or TSM, is that it only uses internal roles. So it's looking at how trauma is internalized in the aftermath of a traumatic experience. So this is both a strength and a limitation of the model in that it's focused on intrapsychic. The founders of TSM argued that before we could do any interpersonal work, that we first had to go and do the internal work. We had to heal from the trauma from the inside out. TSM is a model that really emphasizes the importance of strengths and of safety. And TSM provides multiple safety structures before getting into traumatic content. So TSM is based on classical psychodrama and really absorbs and uses all of classical psychodrama while adding some of their own unique safety structures, such as the observing ego role, which is described as the part of ourself that can accurately see and notice and experience what's going on internally and externally without judgment, without blame, without shame. It's that internal place that we get to when we're in mindfulness meditation. And TSM teaches that this is one of the first roles that's essential to develop in trauma recovery in order to accurately label our feelings, our experiences, dynamics in the world, and to accurately label aspects of the trauma. So TSM has a process of using different cards with different artwork on them to concretize or symbolize this observing ego for each participant. Another important safety structure in TSM is the circle of strengths. And this is one of my favorite exercises. There's another video on my channel where I demonstrate using the circle of strengths with an actual group so you can see it in action. The circle of strengths uses, usually we use scarves or different fabrics to symbolize and concretize different strengths that we see in other group members or within the group as a whole. And we literally create a big circle of the strengths of the scarves in the center of the group room that becomes a stage for the psychodrama. And it becomes a symbolic reminder for all the group members that the collective strengths of the group can hold and contain anybody's traumas and anybody's stories. So the observing ego and the circle of strengths were two unique safety structures that TSM contributed to the psychodrama community. Now, perhaps the most sophisticated aspect of TSM's theory is what's called the trauma survivor's intrapsychic role atom, or the tessera. So TSM proposes a template for internal roles that relate to trauma and trauma recovery. And there's three different aspects of the trauma survivor's intrapsychic role atom, three different categories that correspond to the different phases of a clinical map for safely working with trauma. Phase 1 has to do with safety, strengths, containment, and these are called prescriptive roles. Phase 2 has to do with trauma-based roles, and phase 3 has to do with transformative roles. So there's 8 different prescriptive roles, and these include the observing ego, internal strengths, social or interpersonal strengths, and spiritual or transpersonal strengths, along with strengths related to containment, such as the containing double and the body double. And these prescriptive roles, they're called prescriptive roles to suggest that we might need to prescribe them to clients in a similar way that a doctor might prescribe a medication or a treatment. That these roles are often missing or inhibited or depleted in the aftermath of trauma by the nature of PTSD. And we may have to very intentionally focus on tapping into these roles, bringing them into the psychodrama in order to make it safe enough to move to trauma-based roles. So I think one of the most important contributions of TSM to the psychodrama practice is the emphasis on using strength-based roles before getting into trauma-based roles in any given psychodrama scene. The second category of roles in the tessera is the trauma-based roles. And so this is based on Karpman's triangle, but is a modified trauma triangle. So we have the victim, the perpetrator, and the rescuer in Karpman's triangle. But in TSM, we suggest that because there was no rescuer, the trauma happened. And instead, there was a abandoning authority, some sort of authority, whether it was a person or an adult or a caregiver or a system or a government that was supposed to be there to prevent the trauma from happening, that failed in their obligation and responsibility to do so. That they abandoned the perpetrator, and that abandoned the victim. And that these three roles, victim, abandoning authority, and perpetrator, become internalized within each trauma survivor, and that we act them out internally in the aftermath of trauma, that we victimize ourselves, that we harm ourselves and perpetrate upon ourselves, and that we abandon ourselves in the aftermath of trauma. And one of my own contributions to the development of TSM theory was connecting these three roles to the three symptom clusters of PTSD. that the intrusive and re-experiencing symptoms of PTSD seem to be embodied through that internalized perpetrator role. The arousal, reactivity, the hyperarousal, the loss of safety, the helplessness that comes with PTSD seems to be embodied through the victim role. And the avoidance and dissociative symptoms in PTSD are operationalized, embodied through the abandoning authority role internally. And that the fourth symptom cluster of PTSD, the newest one, which was added in the DSM-5 in 2013, negative beliefs and negative mood states, can really fall into any one of these three trauma-based roles, depending on the nature of the belief. So you can think of the trauma triangle as the operationalization of PTSD through role theory. That these three roles tend to exist within any trauma survivor, and we need to renegotiate them through the trauma recovery process psychodramatically. Third category of roles in TSM are called transformative roles. And so there's a bunch of different transformative roles that have to do with autonomy, with integration, and with correction. Some of these roles include the change agent, the corrective friend, or good enough friend, good enough family member, good enough partner, the manager of defenses, being able to manage all of our defense mechanisms in a healthy way, the appropriate authority role that we have to develop internally to be able to set boundaries and get off of that trauma triangle, another role called the ultimate authority role, which has to do with not only taking authority for our own internal experience, but also stepping into authority in our relationships, in our lives, and in the world. Stepping up and having boundaries, protecting others, advocating for good and change and justice in the world. And there's another transformative role called the sleeping, awakening child in TSM, which is used to describe the part of ourselves that goes to sleep at the time of trauma. Oftentimes, trauma survivors say that they feel like their innocence was taken from them, or a part of themselves died because of the trauma or perpetration they experienced. And in TSM, we try to renegotiate this idea by suggesting that your innocence, your spontaneity, your goodness can never be taken from you. Instead, it goes to sleep at the time of trauma. It detaches from you and your experience because it's too painful and it's not safe. And it's embodied in this transformative role called the sleeping, awakening child. And that it's been asleep waiting for you to reawaken it, to make your life safe enough again, to reconnect with that, and to re-express your spontaneity, creativity, goodness, and innocence in the world and in your life again. So the trauma survivor's intrapsychic role, Adam, is really a complicated idea. And if you wanted to learn more about it, I would point you to the chapter 3 section in my book. So another trauma-focused psychodrama model that emerged is called the relational trauma repair model, or sociometrics, created by Tian Dayton. And so Tian Dayton created the relational trauma repair model, or sociometrics, with a focus on sociometry, a focus on relational trauma, and really focusing on shortening psychodramas into short, focused psychodrama vignettes. So RTR, or Relational Trauma Repair Model, was created in response to the managed care getting involved in treatment and shortening group sessions, shortening length of stays in treatment, and requiring practitioners to work with larger groups and with less training and funding for training. So RTR and sociometrics is really useful in that it doesn't require as much training to facilitate than larger psychodramas or more complicated psychodrama models or enactments. RTR has 2 levels. Level 1, which focuses on sociometry processes such as spectrograms, sociograms, social atoms, timeline exercises, floor checks and locograms, and step-in sociometry. Many of these are discussed and even demonstrated in some of the other videos on my channel here. Level 1 in RTR focuses on psychoeducation, on creating group cohesion, and pen-to-paper psychodrama exercises, such as timelines or social atoms, or psychodramatic letter writing or psychodramatic journaling. Level 2 in RTR focuses on reconstructive role plays. And so these are short psychodramas, usually focused on revisiting frozen moments of trauma within a trauma timeline or within a social atom for the protagonist. And so these reconstructive role plays usually only involve one or maybe two other roles. They're short, they're quick, and they're very focused. So because of that, they're better able to fit within shorter group sessions, whereas a longer psychodrama, you might need 2 or 3 hour session in order to do a full psychodrama with multiple scenes. A short RTR psychodrama you could do in an hour or 75, 90-minute session. So RTR has its benefits, as does TSM and as does classical psychodrama. In my own practice, I like to combine TSM with aspects of RTR with classical psychodrama and with SAMHSA's trauma-informed principles. I find that the 4 of them together provide a really solid and balanced mix, in that they balance out and make up for some of the limitations in the other models that I mentioned. So I like to mix them all together in my work. I find that classical psychodrama can be limiting in that sometimes there isn't as much focus on strengths. Catharsis gets overly focused on, and it can be re-traumatizing at times. It doesn't always take into account the importance of safety of strength-based roles. Whereas I feel like RTR and TSM really help balance out those limitations and provide that focus on safety and strengths and warm-up. I find TSM to be limited in that it's all intrapsychic. And it usually requires much longer psychodramas. And TSM is a model that suggests that you should almost always be working as a team with multiple other professionals involved. Usually there's a team leader, an assistant leader, and other trained auxiliary egos, which is really ideal if you can do that. But in reality, most treatment centers and agencies aren't going to pay for 3 professionals at once to be in the same group. Usually there's only one therapist running a group, maybe 2. So I find this to be a limit to the TSM model. At the same time, I find RTR to be limited in that it's focused on really short psychodramas and doesn't always include strength-based roles in a way that I feel like is often needed to make the process safe. That oftentimes in RTR psychodramas, we go right into the trauma in really deep and quick ways, whereas the process could be made a little bit safer, and it could be done in a gradual, more titrated way by including a strength-based role. So I feel like trauma-informed principles are often inherently embodied in classical psychodrama, in TSM, and in RTR, but very infrequently are they consciously mentioned by anyone that writes about psychodrama. So I find that it's important that we consciously and intentionally try to bring in trauma-informed principles into our practice of classical psychodrama, TSM, and RTR. And in my own work, the 4 of these together, really combined and integrated, provide a really balanced approach. And so in this chapter, we've talked about the importance of psychodrama as a trauma-focused modality and group therapy as a treatment for trauma. So there's unique benefits to engaging in trauma treatment through group work rather than individual therapy alone. that there's places we can go in groups that would be impossible to get to in one-to-one settings, and that trauma-focused psychodrama is a emerging and effective group treatment for PTSD, CPTSD, and other trauma-related issues. That trauma-focused psychodrama is becoming more and more popular and recognized. There's more and more clinical research that continues to validate its effectiveness with various populations, and the neuroscience research really supports it. Trauma-focused psychodrama and the surplus reality of psychodrama allows for healing, repair, corrective emotional experiences, and post-traumatic growth to be embodied in action rather than just talked about. So I really hope you found this video useful and the content in Chapter 3 of my new book. Again, this all comes from Trauma-Informed Principles in Group Therapy, Psychodrama, and Organizations. And you can find this book online. It's offered through Amazon, through any major book retailer, as well as the publisher, Routledge. If you find the book useful, I really would be grateful for you if you were to write an honest Amazon review about the book. Even just a sentence or two can go a long way for helping future people find the book in their searches. And if you found this video useful, I encourage you to write in the comments about what you learned, what was helpful, what do you feel like was missing from this video, perhaps. And I encourage you to stay tuned for future videos. If you subscribe to this channel, you'll be notified when future videos are released, so you can be sure that you don't miss any future content released on this channel. Thanks, and I hope you found this helpful in your work.